Got it. Yeah, good morning. Thank you all for joining us. Today, we're sad to report the highest number of deaths that we've reported in a single day. I just want to go by and list a few of these folks, not by name, but by age and sex and race, to understand that these are people, but for COVID would be with us for next Christmas by and large. These are people who didn't have to die, and that if we did a little bit better, if we collectively were more thoughtful about making sure we didn't spread COVID, these folks would be alive. We have, and this is a random sample of the 79 folks who died reported dead yesterday. 84-year-old white male, 76-year-old white female, 67-year-old black female, 51-year-old white male, 66-year-old black female, 62-year-old white female, 38-year-old black female, 56-year-old white male, 52-year-old black male, and an 87-year-old black female. And this is but one of a sample of the people that we've lost recently from COVID that did not have to die. I'll go ahead and kick it over to Dr. Byers, who will have more to add on the reported deaths.
Thanks, Dr. Dobbs. I just wanted to let everybody know that, when you look at where we've been over the last 4 weeks, we've reported, more than 600 deaths in Mississippians, and that's not including the almost 80 deaths that we're reporting today. When you look at the last 2-week period that ended on the 17th, we had 313 deaths reported, compared to the previous 2-week period of 299 deaths. So our deaths continue to rise in Mississippi. When we look at who that's impacting, we're seeing the vast majority of those deaths occurring in individuals over the age of 65. More than 70% of our deaths are occurring in that group. Although we're not seeing as many deaths in the long-term care setting, we are still seeing a large impact in that group. We have over 160 outbreaks in nursing home settings right now, over 200 outbreaks total in congregate settings. So we're still seeing a very large impact in that. When we look at the number of cases in the 2-week period that ended on the 17th, we had over 26,000 additional cases that were reported. In the prior 2-week period, we had 20,000 cases reported. So when you look at that over the last 4-week period, that's well over 40,000 additional cases reported in Mississippi. So these are astounding numbers. When you look at who this is impacting, we are still seeing the fastest growth in those people who are between the ages of 25 and 39, and in those individuals 50 to 64. So we are seeing the fastest growth of the cases in those age groups. And again, when we look at the exposure types that people are having outside of the home in the 14 days prior to the onset of their illness, we're still seeing lots of exposures in churches, in sporting events, in social gatherings, and in gatherings outside the home and in the neighborhood. And so we're still getting a lot of that reported. And I have to tell you that certainly leads to much of the transmission that we're seeing in the state right now. So Dr. Dobbs, that was what I had wanted to say regarding the deaths. And again, when you look at the deaths that are reported out today, these are new deaths. The more than about 90% of those deaths are reported within the last 2-week period. So these are not deaths that occurred a month ago and are just now being reported. These are all recent deaths, and it really was predicted. We predicted this by the increased number of cases that we have seen in the state. And we know that when we start seeing those large numbers of cases, that the deaths are regrettably going to follow. So, Dr. Dobbs, I'll get it back to you.
Yeah, thank you, Dr. Byers. We appreciate that information. As we look Also, at other situations, you can see, we've been very concerned and warning about overwhelming our health systems, and we've pretty much done it. Just to be honest, if any of you work in a hospital, or if you have family that work in a hospital, ask them what it's like right now. We have absolutely surpassed our average daily ICU utilization. We've surpassed our average daily ventilator utilization, and this is before the holiday season. We expect additional surges. We've learned very clearly that holidays are a weak point for us. We let our guard down, and we allow transmission to occur that doesn't have to occur, sadly. So as we think about going into the holidays, we have some things we'd like to share with you guys. We're going to be posting some holiday guidelines for trying to celebrate safely, and also some guidance for trying to worship safely. As far as celebrating safely, it's best to stay with your nuclear family, people in your household, and make sure if you go in public, wear a mask. That's the safest thing to do. In regard to religious services, the safest thing is virtual services. We do know that some churches will conduct in-person services, but we are strongly advising anybody who's over 65 who has severe chronic medical conditions to not go to in-person worship services through the holidays. We've seen a lot of transmission occur through events where people gather, and especially for any duration of time. Funerals are very, very high risk. So please be careful, and beware of the super spreader at your dinner table. Most people who have COVID don't know they have it. Most people who spread it to you don't know that they have it because they're not sick or they have mild symptoms. Dr. Byers and I tested 17 people for COVID yesterday. 4 of them were positive. 2 of them had no symptoms, and the other 2 had symptoms but didn't think it was COVID. So please know how vulnerable we can be when we mix people who are younger and older around the dinner table. Shared meals are high risk. We've seen this over and over again. There's something comforting about a shared meal, but it's also a comfort that COVID uses to undermine our safety. It's better to share meals only with your nuclear family. I know that sounds difficult in this time of celebration, but we want to get through it and carry as many people across the finish line as we can. So changing the conversation over to vaccine planning, we do want to talk a little bit about where we are within our vaccine distribution plan. Currently, we are in 1A, and 1A will progress for several weeks, and that's going to be essentially healthcare workers, but also long-term care residents and employees who are obviously healthcare employees. You can see that we have distributed 12,600 Pfizer doses to 5 major health systems. This was due to the fact that we needed to have ultra cold freezers, but also they had to be able to consume at least one entire shipment of approximately 1,000. So we have gotten those distributed. Last week also, we activated the long-term care vaccination plan and have dedicated around 60,000 of our Pfizer doses to make sure that residents and employees in long-term care settings can have access to the COVID vaccine. You can see that CVS and Walgreens are going to be our partners in this effort, but it's going to take them several weeks to get it accomplished. It's obviously a very large logistic challenge. Then if you look at how we're looking at everything else for the healthcare systems, this week we're sending doses of Moderna to all other hospitals in Mississippi, and they will be vaccinating over the next couple of weeks. And then starting the first week of January, we will be making more and more Moderna vaccine available through healthcare workers through 18 Department of Health drive-through clinics. We may make it more than that. We're still working on additional sites that might be able to get brought forth. Also, we're going to look at making sure that pharmacies and private clinics that have signed up to be private sources of COVID vaccine can be available to provide COVID vaccine not only for their employees, but also others in the community who are healthcare workers in need of the vaccine. We're also excited that some hospitals are volunteering to vaccinate other healthcare workers within their communities that do not work directly for them. So that's absolutely fantastic news. And if we want to talk about who are healthcare workers, this is just a list of who is considered healthcare workers by the CDC. So we get questions about, who is considered a healthcare worker. If you work in clinical care and take care of patients, then you're a healthcare worker. Includes physicians and nurses, of course, but also dentists, phlebotomists, pharmacists, students who work in healthcare environments. So if you're one of these folks and you work in a clinical environment, we want to get you vaccinated. We want to get you protected. We are very excited to have access to a highly effective, very safe vaccine that could really push this COVID pandemic down on its knees. This is an opportunity for us to look into a future of normalcy, a future of shared joy, visits with our loved ones in nursing homes, and ability to have gatherings that we've missed for so long. So really encourage everyone, especially our healthcare workers right now, to embrace the science, the fantastic science that brought us these two highly effective, very safe vaccines. Obviously, we believe strongly in it. Dr. Byers and I both received the vaccine last week, and looking very much forward to getting the second dose in about another week and a half or so. So anyway, please be safe in the holidays, be thoughtful of others, and beware of the silent super spreaders, because we're going to see a lot of that, but there are things you can do to prevent it. With that, I'm going to stop, and Dr. Byers, unless you have anything else to add, go ahead and take questions. All right, great. So I'm gonna pull up the chat. Liz, anything else before we take questions?
No, I just think it's really important if you all would please share on the news and in all of your organizations about the deaths. It's just a really, the news, of course, is the vaccine distribution, but please emphasize the deaths, because they weren't unexpected, and we need people to follow the holiday guidelines. With that, Dr. Dobbs, why don't you take Nick Juden?
So Nick from Jackson Free Press, we've seen reports from a number of states, as well as Pfizer itself, that the vaccine delivery has been significantly delayed for lack of destinations provided by the federal government. Is Mississippi receiving its full shipments? What else is needed to provide the state with the highest number of doses? We did get a cutback in our allocation for week 2. This is something that we've known for a while. It did delay some of our distribution of Pfizer to some of the hospitals that couldn't consume the entire 1,000, but we switched them over to Moderna. It's a little bit of a hiccup, but it's only a speed bump. It's not going to slow us down, and we do have lots of vaccine doses getting out there. Dr. Byers, anything to add to that?
No, and just to remind that, one of our targets with the Pfizer vaccine right now is for those long-term care residents and employees. And so we are making sure that whatever allocation of the Pfizer vaccine that we get does go directly into that program to make sure that we get those residents and employees vaccinated.
All right, very good. Again, from Nick Juden, there seems to be a lot of disagreement among experts how the doses should be provided. Some argue that the elderly should be prioritized above young people with pre-existing conditions. Will Mississippi be focused on vaccinating individuals above the age 65 primarily, or concurrently with younger folks with comorbidities, and why? Right now, we're still digesting the 1B recommendations, and it is a mix of essential workers, but also those over 75. So we'll be planning to try to meet those needs, but understanding we really do want those who are 75 years and older to please, get vaccinated. We know that that's where a lot of the vulnerability is, but also too, there are certain essential workers that are exceptionally important. Some of our first responders and our teachers among them. I just want to give a huge thanks to all of our teachers across the state who've been brave, making sure we can educate our kids. We need to make sure we get them protection as soon as possible. CJ LeMaster. So along the lines of Nick's question, I want to ask about specific groups targeted for the vaccine by occupation or hazard. Is there a distribution order and ranking, if you will, for those when it comes to first responders, firefighters, elected officials, essential workers, for example? And what does that look like for us? People on social media have made claims that county supervisors will get preference over first responders, for example. That is absolute speculation. We're still working that out, but we will have vaccine for everybody, at some point. We're still working on the details, but certainly the vulnerable folks need to have it available very soon. And we'll talk about any sort of sequencing, but mostly we're going to make it available to all the essential workers and try to get them taken care of as expeditiously as possible. Do I have an update on, from Cassie, WLOX, do I have an update on Greg Michelle's condition? I do not. We wish him a speedy recovery. I certainly would refer to him directly, wouldn't want to speak for him. But we know that he is a critical part of our response and a wonderful human being, and just wish him well. and quick recovery. From Kobe Vance, MPB, are we still on track to surpass 1,000 deaths this month? And how are deaths this year compared to previous years? I think we are on track, unfortunately, to surpass 1,000 deaths this month. If you consider that we're ramping up quickly. So, we predicted that this could be happening. All you have to do is have about 30 deaths a day, and you can overcome 1,000. These are 1,000 people that could be with us next year. These are cousins, these are parents, these are aunts and uncles, these are children. Sincerely, simple things can bring them through the holiday season to the next holidays. It doesn't have to be dismal, but you do need to be thoughtful. And we have, about 6,000 more deaths this year than we did last year. So, these are real deaths. This isn't some artifact of someone calling a death something else. Hear my lips speak this. People are dying from COVID. COVID is killing Mississippians. COVID is one of the leading causes of death in Mississippi. Please be careful. You can't necessarily avoid cancer. You can't avoid heart attacks in the short term, but you can avoid COVID. Stephen from News Mississippi, what is MSDH being told by federal officials regarding the new strain of COVID-19? That's something we're following very closely. It is concerning that we may have a strain in England and in Europe that might be more contagious. The good things that we're seeing is it does seem to be likely still covered by the vaccine, and the severity of illness does not seem to be any more than what we've seen before. We did see that transition early on in the spring. There was a mutation that made it more contagious and became the dominant strain. So something we're watching closely. But the quicker we get the vaccine out, the quicker we shut it down, the less likely it's going to mutate more. I mean, we've let this wildfire run long enough. It's actually just not that hard to control it. We just have to make the simple decisions that'll let us do that. Question from Keisha, Clarion Ledger. Did vaccinations at long-term care facilities begin this week or last week? They haven't started vaccinating, but we have released the allocation sufficient for them to get started. So they're in the process of getting that set up. That's something that's out of our control. But we're hoping within the next couple of weeks they'll get that rolling. Dr. Byers, anything to add to that?
No, and the target date, once we activate that, it takes them a couple of weeks to align all that up with the long-term care facilities. We anticipate that getting all those nursing homes vaccinated is probably going to take a few weeks to get that first dose in and then come back in and do the second dosing. So, but I have to tell you how excited we are about having that opportunity for CVS and Walgreens to come in and assist with vaccinating that vulnerable population. That's going to be so important and so huge because we know of the severe impact that this virus has had on those settings.
Hey, Dr. Dobbs.
Yes, ma'am.
Do you see Steve from News Mississippi? He is asking, what is the MSDH being told by federal health officials regarding the new strain of COVID-19?
Oh, we answered that just a second ago.
Oh, okay. I must have missed that. Sorry.
I think we may have missed one from Jennifer Kay.
Yeah, we did. It's Jennifer that we missed.
Oh, okay. Okay, sorry about that. How many doses of the vaccine have been administered in Mississippi so far? When will that data be added to the state's COVID dashboard? So we are monitoring that. And Dr. Byers, if you want to speak to it, all of the doses that have been administered have not been entered in the registry yet. So we know how many have been distributed, but we don't know exactly how many have been received, although we have many thousands that have been documented already. Paul, you want to give us an update on that? I know it's an evolving question.
Yeah, so this number that we have so far are the number of doses that have been administered to healthcare workers in Mississippi and have been reported through our immunization registry to date, and that's over 4,500 doses to providers have been given, which is good with the 12,600 doses that have already been sent out to those hospitals early on. We'll continue to work with providers to make sure that we achieve the level of reporting we need into the immunization registry so that we can capture those doses administered. That's going to be hugely important moving forward. Additionally, we do plan on having a dashboard up and running this week, indicating the number of doses that have been administered so far, in Mississippi. So stay tuned, and that will be on our website.
From R. Solis, will the vaccines be administered to people who are already experiencing COVID-19 symptoms? If people have COVID, they don't need to get the vaccine, so they need to wait a period of time until they've clinically improved. Now, you can get the vaccine after having COVID. That's perfectly good, and we think it's helpful. But if you're under quarantine, or if you're suspected of having COVID, or if you've been diagnosed with COVID, you need to wait. And CDC has detailed guidance on that, but certainly would encourage everybody to talk to their doc or provider to figure that out. Caleb from the Daily Journal: were 25,000 doses of Pfizer vaccine actually received in Mississippi? When will more vaccine doses arrive in Mississippi? When do you expect doses of the Moderna vaccine to arrive in the state? 12,600 doses of Pfizer physically manifest in Mississippi for distribution. The remainder was allocated for long-term care. So they were never directly in our possession. So, but they've been allocated for the nursing home folks. We are getting more and more vaccine. As I mentioned on our slide previously, we have a lot of Moderna that has now come in. We're still waiting on future allocations. We kind of hate to get ahead of ourselves, but the Moderna vaccine is in the state and is being administered in some locations today. So we're very excited about that. Kobe from MPB: what have you seen in terms of pediatric spread of COVID-19? Could rising spread threaten return to schools in January if people continue going to parties and holiday family gatherings? First of all, let me tell you that last week we had 4 pediatric patients in the ICU at UMC with COVID. Okay, so it can be bad, it can kill kids. It's something that everybody needs to be careful about. Absolutely, it could undermine the ability for kids to be successfully in school. Anything that drives outbreaks and transmission in school is going to undermine things. We strongly, firmly recommend that people keep their gatherings small, and especially within household members. But parties should not happen at all. The governor's executive orders has social gatherings at 10 or less. So we shouldn't be seeing any parties really. And I know people are doing some gatherings at some convention center things or gathering halls that are businesses. I strongly recommend that you do not go, and don't let your kids go. It's extremely dangerous. If you send somebody to one of these parties, there will be somebody there with COVID and probably a bunch of people. Your risk is high. These are super spreader nightmares that we need to be careful about. Nick, many experts have pointed out that a single dose provides extremely effective protection, even if 2 doses is superior. Why not use the second wave of vaccinations on new people? That's a pretty legitimate question. But we do want to get full potency as best we can. Also, for the duration of effect, we want to get both doses. But it is encouraging that the first dose offers some protection. And if we can get as many people vaccinated now, there may be some protection within certain subpopulations, especially healthcare environments or long-term care. So we're hoping that we could see some positive benefits even before that second dose is out within those subsets of the population. Jamie, I can't tell where he's from. Recent study found that every COVID-19 death, approximately 9 surviving Americans will lose a grandparent, parent, sibling, spouse, or child. I think that's true. I mean, we're going to lose folks. We're going to unfortunately spread it. We're all going to suffer. I think more and more people are seeing the impact on our families from personal experience. So that's a great point. Nick, I want to ask a follow-up. Nick Juden, I want to ask a follow-up on my original question. I understand that you filled in the missing vaccines with Moderna. What I want to know is the federal government dragging its feet on any vaccine delivery coordination. I'm not aware of any delays in vaccine coordination. From what we're aware of, is the Pfizer allocation was lower. And General Perna, who's over the distribution effort, had addressed that previously about it. It was a misunderstanding of the available doses. But I'm not aware of any distribution sort of kinks. We've gotten them, on Monday when we were told we'd get them on Monday. So, Paul, have you heard anything of that nature?
No, we haven't. We haven't gotten the impression that the federal government is dragging its feet. I think there's a lot of moving parts to this, and I think it's been a monumental effort so far to distribute the vaccine that we've gotten, and we do anticipate more vaccine on a more regular rhythm coming up in the next weeks.
Kobe Vance, MPB. Nearly 40% of deaths are in long-term care settings. What is being done to limit spread in those areas while we wait for vaccines to become effective? Oh boy, there's a lot going on. We started off aggressively working with long-term care settings, and we continue to do so. We have outbreak teams that are dedicated to response. We have our licensure and other nursing folks and other partners who are helping. UMC is helping too through a program to try to help with infection control. The problem is there's too much community spread, and so they're always being attacked. They're always being attacked by people coming in, mostly employees who have COVID. So it's going to be extremely important to get the healthcare workers for long-term care settings to get immunized. That's the weakness in our protective barrier for keeping folks safe. I will say though, we've seen, by and large, a lot of the outbreaks that we're seeing are a smaller number of people. So even though we're seeing more outbreaks, the size of them, based on our definitions, is better contained. And Paul, anything to add to that?
No, I think you covered it. I mean, we're assisting them with the appropriate PPE to make sure that they are protected when they're providing care to those infected residents. We're making sure that we're providing testing support to those long-term care facilities as well when there's an outbreak. And so, but I have to tell you, the long-term care settings have just really been hit hard during this pandemic. And I think many of them have made heroic efforts to continue to care for those residents and keep COVID out as best as possible.
WQRZ61, with the subject of safety issues on any vaccinations on everyone's mind, COVID, number one, reminders for folks with children, the importance of MMR vax is necessary and not to be forgotten. Yeah, so all vaccines are so very important. The hundreds and hundreds of thousands of lives that we've saved over the past couple of decades, not only from the individuals, but also from preventing outbreaks. So we need to keep our kids protected. As far as the safety with COVID, it's a remarkably safe vaccine, and it's been phenomenally well studied. We do want to make sure, folks, though, if you do have a history of anaphylaxis or severe drug allergies, in Mississippi, we do encourage you to go ahead and talk with your physician or your allergist, whoever your main person is, to talk about it, to make sure that they think it's the right thing for you. We want to be careful because that's really the only group of folks that seem to have any issues so far, and even then, it's extremely rare. CJ Lemaster, could you provide a little bit more clarity on where we are in the process? Has phase 1B officially begun? No, phase 1B has not officially begun. If not, when do you expect that to start, and when would 1C begin if you had to speculate based on anticipated demand? Well, that's a tough question. It's hard enough to speculate on 1B versus 1C. I think when Dr. Byers and I were talking about it this morning, some of it's going to be a dynamic decision process. Once we start seeing the demand for 1A healthcare folks, once we've sort of saturated that population, we'll probably overlap it with 1B. But as you saw, it's going to be weeks of 1A before we can even think about 1B, and then and some of it's also going to depend on allocations that are not entirely clear. But as we get more vaccine, hopefully we can move that way. Maybe as early as sometime in January. Keisha, Clarion Ledger, can you give a rough number of how many doses were cut from the week 2 shipment? It was some thousands of doses. I can't remember. Paul, do you remember how many doses were cut from?
No, we don't have the exact number. Certainly, we can get that to you. But I think it's important again to understand that we got the full allocation of Moderna that we were expecting. We received Pfizer vaccine that has been allocated towards the long-term care settings, and we will continue to get those Pfizer allocations that we receive dedicated to those long-term care settings until we have enough vaccine there to provide for all the residents and employees.
Nick Juden, could the governor bring a faith leader to his press event to speak to the public to urge Mississippians to follow his example and keep church events virtual, as he did early in the pandemic? I think that's a great idea. Christmas seems like an extremely dangerous situation fast approaching. It is a difficult time. It's going to turn something that's normally a joyous occasion into something that could be potentially dangerous. I'm sure the governor's going to hear this, so if he wants to, I think it's a great idea. We also at the Department of Health are going to be having a communities of faith conversation with faith leaders across the state this evening. So we'll be talking with them, trying to make sure that they can approach it in the safest way possible. Keisha from Clarion Ledger, a fair number of Mississippians, and notably among Black populations, have expressed a good amount of reluctance about getting the vaccine at all. Is MSDH developing information campaigns to address people's fears? Absolutely, we are working on that, and we've embraced Black leaders, people with influence throughout the process. And as a matter of fact, we're having a COVID-19 vaccination call with JSU at noon today, talking with, it's like basically anyone, especially focused on the African American community. So I tweeted that out last night. If you're a Black Mississippian and want to get more information and have more conversation and ask me questions, strongly encourage you to join me with our JSU colleagues at noon today. Joey Barnes, WCBI. One hospital in our area was supposed to receive the Moderna vaccine yesterday, but it was delayed. They were supposed to administer the vaccine to employees today. Now they plan to do that on Monday. How big of an impact does this have mentally on staff? And are you worried that some delays could have a larger impact on frontline health workers physically, mentally, or health? You know, they were scheduled to get Moderna anywhere between Monday and Wednesday. I'm not sure if that was a delay or a lack of clarity on when it was going to arrive. Certainly we can look at that, but I do know that quite a few hospitals that I knew that were supposed to get it Monday did get it Monday. So I'm not sure, but you know, today is Wednesday. I do hope that they can get folks immunized as soon as possible. But regardless, we should all be safe over the holidays. You know, this is a very complicated thing. You know, a 1 or 2 days delay is maybe going to happen from time to time, just the way things operate as far as deliveries. But by and large, I think the delivery logistics have been pretty remarkable. Dr. Byers, anything on that? I wasn't aware of that one specifically. Kobe from MPB. Question for Dr. Byers. I'll let you read it. Can you see it? It's 10:02 from Kobe Vance.
Yeah, could you talk about the new study released by UMMC and the CDC that confirms children are more likely to contract COVID-19 in social gatherings than in school? What were your thoughts on these findings, and what do you believe the data will help inform parents to avoid these gatherings? So I think it's important for us to think about what the data showed. And when you looked at children who were infected versus those children who were tested but not infected, and you looked at their exposures in the couple of weeks prior to the onset of their illness, most of those children who were infected had multiple exposures that were more of a social nature. They were exposed at play dates, at parties, at some extracurricular events outside of the school setting, as opposed to those children who were negative, were less likely to be exposed in the school setting. And I think, you know, we've talked about this, that for those children who are in a classroom setting where they're wearing a mask and it's a structured environment where individuals are 6 feet or more away from each other, we feel like that children can be educated in that environment relatively safely. We have seen transmission that's occurred in the classroom. Certainly, we've seen transmission that's occurred in schools. But we feel like in that very structured environment within the classroom setting, that children are relatively protected. Where we let our guard down and where it really breaks up is outside of that school setting, when children are exposed to multiple other social activities where they may not be wearing a mask. And I think it drives home the point that we've been trying to make. And that is, you've got to wear your mask consistently. You've got to cut down on those social activities outside of your nuclear family, those extracurricular activities that may be associated with schools where parents and teachers let their guard down and are not wearing a mask and are assuming that the person across from them is safe and COVID-free. That's where that transmission occurs. It's not from the person that you know is sick, it's from that individual that may be pre-symptomatic or asymptomatic, has COVID, doesn't know it yet. And if y'all are not taking the appropriate precautions consistently and assuming at any point in time that everybody that you and your children may interact with outside of your home setting may have COVID, then we're going to see that transmission occur. And so I think bottom line is that it reminds parents that we have to practice those same principles in all activities.
Ronnie Mott from Vicksburg Daily News. We're seeing a lot of pushback on numbers from folks saying no one is getting the flu, colds, heart attacks, etc. Can you address overall mortality and illness rates to help bust up those myths? Yeah, holy moly. We live in a conspiracy culture. If one person says a lie and another person repeats it, then all of a sudden it becomes a fact, right? Yeah, that's just total crap. Now we aren't seeing as many flu cases right now, right? But sometimes we don't see that many flu cases this time of year. If you look back, I think maybe 2017, the trend looked about the same. But it may well be that people are getting it less because of masks and social distancing. I mean, we saw that in the Southern Hemisphere. If you hear something and it doesn't sound true, look for the data. We've published the mortality data on our website, and heart attack deaths are up in addition to COVID deaths, right? So people are getting heart attacks. It's just not true. I mean, people make junk up all the time. Someone said I didn't really get the shot, and made up all this kind of wacky stuff. I can assure you, I got the shot, and I'm super excited to get it. I've been waiting for it forever, and my wife's getting it today. And as soon as my kids can get it, I'm going to get it to them. My wife's a physician, by the way. The other thing, other silliness that comes up all the time. Yes, someone accused me of being at the governor's party. Just made it up out of nowhere. I mean, you can't just make stuff up. So please don't believe it. If it doesn't hold water, don't carry it. Caleb from Daily Journal. How many doses are in the Moderna allocation? 50,000 there, more or less. And so far, we'll have more in the future, hopefully. Natasha from the New York Times. Are you able to provide details on the total number of Pfizer and Moderna doses that have been received in the state as of today? Yes, 12,600 of the Pfizer doses have physically made it to Mississippi and been distributed, and around 50,000, there may be some odd more than that, that we have received in the state of Mississippi.
And just to jump on that, so the total Pfizer allocation we've received initially was 25,000 doses, and we've received Moderna vaccine of 50,000 doses allocated to Mississippi for our use. And we divided that up accordingly as we've described. And we anticipate more allocations of Pfizer, more allocations of Moderna in the coming weeks.